Dr. Elisha Van Dusen here with New Hope Chiropractic. Did you know the term jumper's knee was first coined in 1973, and it describes an injury to the tendon that attaches to the lower part of the leg, the tibia, or the shin bone, to your patella, which is your kneecap, to the lower part of the quadriceps femoris muscle, which is muscle that runs along the top part of your leg, top front part of your leg. And jumper's knee is one of the more common injuries or tendinopathies that affect up to 20% of all adult athletes in sports that constitute frequent jumping, typically among adolescent basketball and volleyball players. And individuals who are obese or who are bow-legged or knock-kneed or whose lower limbs are unequal in length have a higher risk actually for jumper's knee. Poor jumping technique can also increase the risk for this condition, as can overtraining too, especially if you overtrain on hard surfaces. The disease process for jumper's knee can be divided into 4 stages. Number 1, pain only after the activity without disability. 2, pain during and after without disability. And then 3, prolonged pain during and after, which affects function. And then 4, complete tendon tear, where you need surgery basically. Treatment for jumper's knee can include reducing the jumping activity, of course, number 1, or number 2, icing the knee for 15 to 30 minutes, 4 to 6 times a day, especially after the activity, or 3, a thorough exam of the hip, knee, ankle, and foot to look at the joint functions. Number 4, stretching the hamstrings, the calf muscle, the quads, the hip flexors, the glutes in your buttocks, the iliotibial band, and also the different tissues around the kneecap. Number 5, strengthening exercises that focus on specific parts of the quadriceps muscle and other leg muscles, and also ultrasound and other therapies that can help speed up recovery too. And 7, you can also tape up the knee to help with the patella, the movement of the patella and the tendon, so it's basically going in the proper path and doesn't get worn down. Doctors of chiropractic, myself, were trained to evaluate and treat the whole person and frequently treat athletic injuries too. And a successful treatment outcome for jumper's knee requires both local knee care of the knee itself and also the management of the entire lower kinetic chain. Now, this would include the foot, the ankle, the knee, the hip, and also the pelvis. And unless all these things are treated and looked at least examined and looked at, the success rate of helping people with jumper's knee goes down a lot. So anyway, if you have knee issues that I've just described, or you know somebody who does, have them check out our website, newhopechiropractic.com, and just make an appointment through the website, and we'll be happy to take a look at them or take a look at you and help get you on the path to better health. So with that, have a healthy day.